President Obama is sending up to 3,000 American troops into the heart of West Africa's Ebola epidemic. His new plan follows criticism of the U.S. response to the outbreak. At least 4,700 people in 5 countries have been infected. At least 2,400 of them have died. Dean Reynolds is at the Center for Disease Control in Atlanta, where the president will speak this afternoon.
Good morning. The Obama administration is calling this a significant expansion in the U.S. fight against the most severe Ebola outbreak in history. Thousands more in U.S. personnel and millions more in U.S. aid will be sent to West Africa in the hopes of turning the tide. In a 4-pronged attack, President Obama will increase U.S. resources in West Africa aimed at slowing and eventually stopping the spread of Ebola.
We're going to deploy their knowledge and resources to try to help some of the governments in Africa meet the needs of their people.
Called Operation United Assistance, the administration hopes to galvanize international partners into action while significantly expanding its own contribution.
Making an investment here early is critical to trying to snuff out this problem before it becomes a much more widespread problem.
Among the investments, an additional $88 million for equipment and supplies, 17 treatment units, each with 100 beds and up to 3,000 military personnel to help contain the epidemic, and train up to 500 medical workers per week for as long as needed.
What we say is train the trainers, right? Train the local people so that they can do all the work.
Time is critical. The epidemic is growing exponentially and supplies are rapidly dwindling. Officials say assets will be on the ground within weeks, but international aid groups like Doctors Without Borders have been sounding the alarm for months. The U.S. focus will initially be on Liberia, where the rate of infection is fastest.
This is a very large epidemic. It's going to take a lot of effort over a long period of time. This is not going to be over quickly.
Now, to push for greater international involvement, the U.S. is calling a special session of the UN Security Council on Thursday to discuss the global implications of the Ebola outbreak. And Mr. Obama is going to seek stronger commitments from other heads of state at the UN General Assembly next week.
President Barack Obama is pledging more U.S. assistance to help contain the Ebola outbreak. The White House says that he's had a telephone conversation with UN Secretary General Ban Ki-moon. The president has said that the deadly outbreak is a national security priority for the U.S., and the American military will help set up isolation units and equipment in West Africa. Obama does admit that Ebola is not a short-term threat in the U.S., but he tempers that by saying that it could eventually become a problem if it's not handled carefully.
President Barack Obama plans to dramatically boost the U.S. effort to reduce the Ebola outbreak in West Africa. He's expected to detail the plan during a visit to the Centers for Disease Control and Prevention in Atlanta on Tuesday. The strategy has 4 components: control the outbreak in West Africa, improve the region's public health system, train healthcare providers and officials, and increase support from international organizations. Mr. Obama is expected to push Congress to approve a request for $88 million to fund his proposal. He also plans to ask world leaders at a UN gathering next week to provide funds, materials, and health workers for a more robust international response. The latest outbreak has resulted in 2,400 deaths, and more than 4,700 people have been infected. According to the World Health Organization, the true toll is likely much higher. Public health experts have warned that the current global response is inadequate to subdue the epidemic and that it threatens the U.S. and other countries, not just West Africa. Administration officials stress that the chances of an outbreak in the U.S. are low.
These ties that historically the Liberian government have with the United States in order to try and galvanize what she is calling for direct aid. Now, the United States has already pledged around $100 million worth of medical equipment. They've also, through the body of the CDC infection unit, been helping with logistics and managerial organization of some of these medical facilities in Liberia. But what the president has really really calling for is direct involvement. They want the United States to come up and set up directly and manage treatment facilities in Liberia. The Liberian president, in a letter to the US President Barack Obama, said that they are around 1,000 beds short in order to treat the growing number of Ebola patients, and that's really what she is calling out now for more international support to try and make up that shortfall.
Now, a particular hallmark of this outbreak has been the loss of life among healthcare workers. At least 144 have perished. One of the latest, a highly respected female doctor in Sierra Leone. What more can you tell us about that?
Yes, Dr. Olivette Buck was one of the key doctors leading the fight against the Ebola epidemic in Sierra Leone. This is the country which borders Liberia, the third country to become infected during this spread of the Ebola outbreak. Now, earlier in the week, the Sierra Leonean government had asked for assistance from the World Health Organization. They asked for funding to evacuate Dr. Buck to Germany in order to receive expert Ebola treatment. However, the WHO turned down that request. They did say that they would do all they could to ensure that Dr. Buck had the very best care that could be offered in Sierra Leone. However, that care wasn't enough to prevent her eventual succumbing to this Ebola virus, and that will come as a serious blow to Sierra Leone as it continues to fight this disease, because, as you said, healthcare workers have been some of the key victims of this disease. That is making, obviously, the fight harder. It's also putting off other healthcare workers from even turning up to work to try and fight this disease. They're saying that if even top doctors can't prevent and protect themselves, then what chance do people, perhaps without that similar level of training, have?